Very warm greetings to all. We are here for the TANUVAS Global Large Animal Sciences Webinar Series 2, 2021. So we have started this webinar yesterday, and we had a critical care and medical management of diseases in force by international speaker, Dr. Elizabeth Carr, Associate Professor, Large Animal Clinical Sciences, College of Veterinary Medicine, Michigan State University, USA. And today we have our international speaker, Dr. Brandon FRASER, to speak on medical management of disease of small ruminant. And I would like to introduce the speaker for the benefit of the audience. Dr. Brandon FRASER is a registered specialist and a diplomate of the American College of Veterinary Internal Medicine. He is a senior lecturer and production animal clinician at the University of Queensland, Australia. He received his Bachelor of Animal Science degree and Doctor of Veterinary Medicine degree from Colorado State University, USA. Brandon completed an internship in farm animal reproduction medicine and surgery at the University of Illinois, USA. His residency in large animal internal medicine and Master of Biomedical Science degree were completed at Kansas State University, USA. Brandon worked at Kansas State University as a clinical assistant professor before joining the faculty at the University of Queensland. Now may I request on behalf of organizing secretary or committee, Dr. Brandon FRASER, to give a beautiful lecture on medical management of disease of small ruminants. Over to Dr. Brandon, please.
Oh, thank you very much for everybody coming along. First of all, I want to thank the committee members for the great honor of being invited to come along to speak here. And I hope that there's a lot of small ruminant fans out there. One thing that I do since there's a lot of vet students out there and grad students out there, one thing that I always like to do for my first lecture of the year to my vet students is like to tell them a little bit about who I am, how I got to where I am. And that was a great introduction. Thank you very much. Just for a little bit more, I came from a small hobby farm. Both parents worked full time. I raised cattle, sheep, pigs, turkeys, grain crops, forage crops. And I didn't really know what I wanted to do until the end of high school. Decided I'd try to get into vet school, and I was successful. Into vet school, didn't really know what I wanted to do. I knew I liked cows and sheep and goats, and so I decided, well, I'll do an internship, and still a little unsure, so I did a residency, and then I became an academic, and honestly, I was not the person that I was expecting to be an academic. I went to vet school to be a mixed animal rural practitioner. So I just tell you those things just because I encourage my students to ask their mentors how they got to where they got, because there's a whole lot of different things that you can do in veterinary medicine, and especially in the global realm. With your degrees, you can really go into a great deal of things. If you have questions, please write them down and submit them, and I can answer them at the end. So please don't hesitate to ask any questions that's unfamiliar, and hopefully we have a wide range of nations represented today with different diseases that are more common or less common, and we can have discussions about any of those different diseases. So general principles or objectives, there certainly are challenges with farm animal practice and small ruminants, and really we want to try to limit the problems as best as we can as veterinarians. And also we'll talk about some economic evaluations. Now there are a wide range of small ruminants. There are the small ruminants that are truly just production animals, and then there are the animals that are quite valuable. I've certainly worked on plenty of small ruminants that are 10 grand plus, 5-figure animals, that the owner basically says, do whatever you can, or pets. Pets are certainly a real common thing that we deal with small ruminants. Okay, these are the basic objectives, and I have supplied the slides, so you will receive the slides, so you don't have to take a whole lot of notes outside of what is not on the slides. So these are some of the things that we will be discussing today that I find to be common that we deal with our small ruminants, and hopefully I can give you some tips and tricks to deal with some of these. So respiratory disease is a little bit different in small ruminants than other ruminants and other most mammals. Their lung sounds are naturally more harsh than other animals because they actually have more mucus in their bronchioles than other animals, and naturally makes them sound a little bit louder. So it does take a little bit of practice and doing clinical exams on the animal to get a good ear for what is normal and what is abnormal. And I certainly encourage my students to do as many clinical exams as possible because when I graduated, my clinical exam skills did improve significantly over the next 3 to 4 years of examining animals. It's a skill that we don't master, or at least I did not master, and many people that I talked to did not master before they graduated vet school. So it's really a repetition. The more that you can get, the more that you can train your ears and your eyes. It's always kind of funny. The best example I give is when we look at radiographs, and we as students look at a radiograph and say, what we see, and then a radiologist goes and looks at it, and they describe so much more, and we can barely see it. But after years and training, we can start to see all those changes. And it's the same things with our ears of hearing these respiratory sounds in sheep. There's a lot of diagnostic testing that we can do for respiratory disease. It's reasonably common that we do some blood work and that we can see a left shift on our blood work and, some inflammation and, some fibrinogen increases. So that's a really good common start point. A couple other things that we can do is a tracheal aspiration or tracheal wash or a bronchial alveolar lavage. And the one thing that was really interesting, so I was at the World Buoyatrics in Japan a couple of years ago and listened to a talk that was saying that a bronchial alveolar lavage or BAL was actually superior for finding the bacteria that was responsible in cattle. Now, I've been keeping my eye out trying to find the paper published. So it was an abstract, but that was really interesting. That just gets me to think about all the dogma that we still need to always challenge the old dogma of what we always thought was the reality. And of course, necropsies. I always tell my clients that a necropsy is some of the best money that we can spend for diagnostic purposes. And it's always up to the owner whether they do it or not. There's reasons for them to do it and not to do it. Sometimes it's a beloved pet or even a star. We've seen a goat that was actually a YouTube star here in Australia. But they may not always want to do a necropsy. So we do have to try to make our diagnosis as best as we can, ante-mortem. Certainly in a production system, necropsy is very valuable. And even on most farms, it is a very valuable thing to do for most diseases. And we can certainly diagnose a great deal off of our necropsy. So I usually encourage my clients to do a necropsy. Okay, imaging. I use an ultrasound a lot for respiratory disease, and I'm usually using my rectal probe that I have out for cattle pregnancy diagnosis. Usually it's a 3.5 megahertz probe, and you can fit that in between the ribs, and you can give yourself a lot of diagnostic value with that. If you're unsure about your stethoscope, you can use your ultrasound, and it gives you a lot of really good value, especially in the field if your practice has a transrectal probe for that. Really works great, and the clients really appreciate it. It's kind of funny. Sometimes I say that as veterinarians, we have to kind of put on a show almost for the clients. I had one client recently that I did ultrasound a thorax of a sheep, and she just couldn't believe it that I had an ultrasound I could take into the field, because when she needs an ultrasound, she needs to go to the GP, and then she needs to go to the diagnostic imaging center, and she spends half of her day, and I'm out there. I did my exam, ultrasounded, done in 30-40 minutes with all of my diagnostics. So she was really pretty impressed that we could do such things. And sometimes it just becomes a little mundane for us, and we forget how much we can really offer with some of our instruments. Radiographs, certainly really valuable. These pictures here are of a mini goat kid that came in after hours, and I took my own radiographs. And it had respiratory distress, dyspnea, wasn't really sure what was going on. Took some radiographs, and I did gotograms, which most radiologists frown on, but the next morning the radiologist thought they were pretty good, and they didn't give me a hard time for it. Unfortunately, there wasn't a lot going on in the thoracic field. I didn't notice it, and I always have a hard time appreciating it, but there was like a little bit of a line in between the trachea here. And I put it was a couple of kilogram goat kid. I had it on oxygen, IV fluids, the full yards, and it stabilized. It did okay. And then the next day, it coughed up a piece of grass about 12 centimeters long. It was one of those cases that just kind of humbles you, that it was such a thing that you didn't really expect, you didn't think about, or I didn't think about. The goat recovered fantastically. The owners were really happy with it, but it was one of those cases that it was strange. I spent a fair amount of money stabilizing the goat, and all it had to do was cough up a piece of grass. Pretty unusual, but I always talk about some of the wins and some of the tough cases that I've had. Okay, so with acute pneumonia, we usually have more Pastorella and Mannheimia hemolytica than other ruminants. It is certainly one of the more important infectious bacterial diseases that we have in sheep and goats, and it is a little bit different in managing than typical bovine or cattle pneumonia, if you're more familiar with cattle pneumonia. So there are several species that are bacterial species that are involved and instigated, and they are similar to a lot of our cattle species, though antimicrobial, they do seem to respond differently from most of the literature and anecdotal responses of myself and other veterinarians that I've talked to. the more common diseases that we see, or sorry, the more common antimicrobials that we use is Oxytet is the primary one that I use, and the one that seems to be the most effective for undifferentiated bacterial pneumonia in small ruminants. This was a little goat that I had in the radiographs before, just this little cute tiny goat. Those are my hands. So you can tell that it was a quite small goat that had, I just think it's a cute picture, had the IV line in and nasal oxygen, and it did great, as said before. There are a whole lot of antimicrobials that can be used. Though I said, if I don't have it differentiated, if I don't have a bacterial culture, either off of a tracheal wash or necropsy, I reach for oxytetracycline first off. And I use the 20 mg per kg dose. I'll go 20 to 30 mg per kg dose. If it's really severe, I can cut that back down to 48 hours. Though I try not to keep them on for more than about 10 days of Oxytet, because it can cause some renal issues. If an animal needs to be on longer term, penicillin is great. Ceftiofur is always a questionable antimicrobial that we use, as we all know, with the trying to preserve antimicrobial resistance or prevent antimicrobial resistance. I do really like florfenicol in small ruminant respiratory disease as well, or Nuflor. And as I talk about some of these drugs, I know that this is an international group, and not all of the pharmaceuticals that I'm going to talk about today are available in all countries. For example, something that I found interesting a couple years ago is that I found out that when we talk about sedation, that ketamine was not available in Vietnam. Was that to rework some of my suggested sedation protocols. So those can be some things in the questions if certain pharmaceuticals are not available in your country, wherever you are listening from. One thing I should note is tilmycin, or Mycotil. It is toxic to goats. Mycotil is the brand name, and it is also toxic to humans if they get injected by it. So this is an example of a drug that is available in Australia, but I do not carry on my truck because I have students with me, and it is toxic and deadly if accidentally injected in humans. Not that I can remember a student getting more than a needle prick that we do obviously report, but of any drug, but it's still one of those big worries that I always have. Okay, we have progressive pneumonias, and these are really not, they're non-curable pneumonias. So ovine progressive pneumonia, OPP, progressive interstitial retroviral pneumonia in goats, which is your CAE, Caprine arthritis encephalitis, and ovine pulmonary adenocarcinoma. And they're fairly well distributed around the world. There will be some countries that don't have them, which is great, but they're very difficult diseases to contain and can be difficult to diagnose. So really, if they're diagnosed, then they need to be isolated, quarantined if they are valuable or pets, and provided supportive care, or euthanized and having the rest of the herd or flock examined for these diseases. They are certainly very severe diseases. Okay, progressive pneumonia, they really end up being terminal. So they just continue to lose weight, and this is a goat. They can see is obviously very skinny, has lost a significant amount of weight. You can see the ribs really sunken in, probably not eating really well. And its lumbar vertebrae are very quite prominent. So this animal has lost a great deal of weight. So progressive pneumonia is a differential for chronic weight loss in our small ruminants. And it is something that you will see, you will see skinny small ruminants, and it's good to have start to get a list of differentials for the skinny sheep or goat. And we'll talk about a few more of those diseases that can cause the skinny sheep and goat. Oops. Mycoplasma pneumonia certainly is a problem, but it's usually considered a less benign or more benign bacteria, and then other bacteria come in and cause more severe disease. So it can be the primary problem, but the big issue is that it ends up causing an immunosuppression and allows other bacteria to go and set up shop and cause significant disease for these animals. So treatment can be a little bit different. If it's undifferentiated, tetracycline still is okay for mycoplasma. Macrolides tend to be the best in my experience. So that's probably what I'll reach for if I do actually have a confirmed diagnosis of mycoplasma and I don't have, or before I get a Coltrane sensitivity off of it. Chronic pneumonia. This can happen in a lot of different scenarios. So sometimes the animal will get a more mild pneumonia or even a severe pneumonia that it does recover from as a younger animal, and just maybe an abscess forms, and then when they get older, they go through a period of whatever stress, that being heat stress, transport stress, and that abscess can set up shop. Trupperella pyogenes is going to be the most common. It's the most pyogenic organism in our ruminants. Do note, we will talk about Corynebacterium pseudotuberculosis in this talk, but it can be a result as well. And it can be a wide variety of signs. So when I have an animal that's showing non-specific signs, that's not really specific, I'm often looking at the lungs and investigating the thorax as closely as I can. So we will, with these chronic ones, especially abscesses in the lungs, you will need to do antibiotics for a long period of time. Procaine penicillin is pretty safe for long-term use in the ruminants. And like I've said before about the possibility of renal injury with long-term use of oxytetracycline, there are some heroics that you can do. You can do if there is a significant pleuritis and abscesses in the lungs of ruminant, you can do a rib resection. I've only been involved with one of those, and that wasn't a small ruminant, it was a heifer. But the great thing about ruminants, the mighty ruminant, is that they have a complete mediastinum, so you can have half their lung collapsed, and as long as you don't try to exercise them, they do fine in a pen with that, and drain the abscesses and lavage the one side of the thorax. So It is pretty cool. It's definitely heroics though, and not for the everyday animal, I suppose. Okay, dystocia. Dystocia is something that I say that keeps all of us humble as veterinarians. You might go along for a year or even years and nail every dystocia, get every dystocia perfectly correct, every lamb, kid, calf, whatever you're dealing with, is delivered perfectly, and then you just come into a incredibly difficult one, and you're out there for hours, and you're just so sore at the end, so tired. But it happens to us all. Happens to me, and yeah, every veterinarian I know gets into a bad dystocia once in a while. So that's why we try to get as many tips and tricks as we can to do the dystocia a little bit better. And when we get into those difficult situations, we can hopefully perform a little bit better. Lube. In dystocia, you can't have too much lube. And one thing for smaller ruminants that really can help is you add a little bit of lignocaine or lidocaine if we have some of those American friends over there. Same drug, to lube and inject it with a large syringe. You can use J-Lube. J-Lube is amazing. It's very, very slick and slippery and works great. Though there is several papers out there that show that if you do a C-section and the J-Lube gets into the peritoneum, it can cause peritonitis. So it is something that you have to be careful with. I know lots of veterinarians that love J-Lube. So I don't think that it's a bad thing, and I certainly encourage people to use it. But just be aware. We just have to be aware of all the things we do, I suppose. I really like epidurals. Majority of my dystocia these days, I suppose I do with epidurals. For small ruminants, you do need to use a 20 gauge needle because the bevel is actually a bit shorter, and an 18 gauge bevel is a little bit longer, and it's a little bit too long to reliably get into that epidural space. The dose that I use is 1 ml per 130 kilos, and I use that, so that's pretty well guaranteed. Whenever I've used it, I've never had an animal go down. I've never desensitized the rear limbs. So that, and it does reliably desensitize the perineal region and the vulva and vagina of the animal, and can help you out quite a bit. So I'd like to talk about differences of small ruminants and versus cattle. Usually there's about a 5% assistance rate from what the literature supports. Abnormal posture is really the most common, and so that's a backwards head, legs, and in difference from cattle where fetal pelvic misproportion is the most common. And we can also get uterine torsions. We can get uterine torsions in cattle, and of course, but we can also get them in small ruminants and alpacas. If alpacas and llamas are a common thing in your country, but we don't necessarily need a plank in the flank. We can just kind of massage the fetus and roll the dam around like you would a cow to get that out. And just to shout out, this was my intern when I was a resident, Dr. Jesse Monday. So, yep, just a shout out to one of my mates, because I use her in my lectures, and people always get concerned when I use them in my lectures. Okay, C-section. I don't think that you should be intimidated by a C-section in a small ruminant. So I've worked in America and Australia, and I have a lot of veterinarians that say they have a lot of problems with C-sections in small ruminants. So I want to provide some tips that work well for me. I have a pretty good success rate with C-sections in small ruminants. Anesthesia, general anesthesia, probably would be great. I've never had really that option where there were just financial constraints. When I was a resident, I had my resident mate did have a cow that she put under anesthesia, that there were no financial constraints. But what I really like to do is what's called a CAT stun. And this came out of Ohio State University quite a while ago. So I'll draw all these up, and I'll give half IV and then, or half IM and then half IV. So that works pretty quickly and gives me a good, usually a good hour, but usually we can get it, and that should be plenty of time to finish up a C-section on a small ruminant. So this is where I really like to incise, kind of a lower flank on the animal on the left-hand side, and I'll put them in right lateral recumbency on a table. Obviously put some towels down to, support their joints and their nerves. And then I'll tie down their legs with some dog leads or some ropes. And they really tolerate it quite well. Usually do an inverted line block on small ruminants. You can do a paravertebral, but it's just a little bit more difficult. But the inverted L works pretty well for these guys. And to sew the uterus, really like an inverted pattern, and you can find these patterns on the DROS project .org out of Florida State. And this is really the best place that I've found how to do this pattern properly and how to finish it properly. So I do encourage it, and I do use these slides, but just for all things fair, I do donate money to the DROS project because I do use their material fairly often. And then pharmaceuticals for the dam, anti-inflammatories, of course. They just went through dystocia. Really like Flunix and meloxicam. I'm probably reaching for meloxicam most of the time. It has longer pain relief, and there's a lot of literature to show the pharmacokinetics, as well as Flunixin, but it just has a longer action and less injections that the owners have to do or the animal has to deal with. If it's a quick, clean C-section, antibiotics probably aren't required. But if it's a little bit delayed or you have to make multiple incisions into the uterus, then something like tetracyclines, oxytetracycline works real well for that. And I will say one of my kind of pedestal points is that I think one of the hardest things as veterinarians have to do is to not give antimicrobials when not needed. It's really easy to say, well, just because it might need it, I'll give some antibiotics, but we all know the world situation of antimicrobial resistance is continuing, and it's all of our jobs as medical professionals to try to slow that down as much as possible. Okay, lidocaine or lignocaine. In small ruminants, it's generally considered, and what I use is 5 mg per kg is the max dose that I will give to a small ruminant. So I'm usually going for 4 mg per kg, and if I need a little bit more, I have that last mg per kg to finish off my blocks. What we can do is we can dilute with sterile water or saline, 1-to-1 or 1-to-2. And anecdotally, I try to look for literature. If anybody knows of literature, it'd be great I would be happy to read it. But I haven't seen any anecdotal evidence that shows that it's less effective when it's diluted 1-to-1 or 1-to-2. What that does is it gives you a larger volume to spread that ligocane out to a greater area. Okay, newborn care. It's pretty similar across species, and there are a few things that we need to mention. Need somebody to catch the newborn, so the surgeon will pull the newborn from the uterus and pass it over sterilely to another participant. And really, for the most part, unless it's really a critical neonate, anyone that can listen. I've had small children resuscitate for me when the neonates are reasonably, non-stressed, I guess. And you want to keep them sternal. There was the old dogma that you want to hang them upside down, and it still is a thing in some parts of Australia, and it just drives me crazy. What happens is fluid comes out of the mouth, but we've learned that the fluid is coming out of the stomach and not the lungs. And there is actually really good literature to show that sternal recumbency has the best cardiovascular performance. It is in calves. We do have to extrapolate to small ruminants. But I do strongly believe the same thing in small ruminants. Don't swing the animal. I always say don't swing the baby. There's still people that are swinging puppies, and they can have subdural hematomas, and we can cause a lot of problems and put that animal into compromise. And really, you're rubbing vigorously, usually with a towel or whatever you have. I've been known to shed my coveralls to donate to that animal, to get it rubbing vigorously, and to sweep out the mouth of any excess mucus. If you have a suction syringe, you can suck it out, and that's great. Coupage, which is slapping the animal on the side, and you can hit them or slap them fairly hard. Even small lamb or goat, you want to be able to hear it. There are various pharmaceuticals that we can use. Such as Dopram is probably one of the more common things that people use, and it's under controversy, and it goes in and out of vogue all the time, because what it causes, the issue with it is that it causes an increase of oxygen consumption in the brain, and this can cause some cerebral hypoxia. But if the animal is not breathing, I'm not afraid to use it. So usually our ruminants don't have to do higher math later in life. One thing that I have trained many owners to do also is an acupuncture called Governor Vessel 26, GV26. On us, that's right where the philtrum is, or right here where the little nodule or divot is, right below our nose. What I usually do with our ruminants is I'll pick that lip up, and I'll just go as high as I can, right on the gums, and I'll peck it with a needle. Small ruminant, I'm probably using a 22-20 gauge needle or so, and you're pecking the periosteum, and it actually does work. It does stimulate the animal to breathe. It's really an easy thing to do, and quite effective. And of course, oxygen. Oxygen is always good. If it's in the hospital, that's excellent. There are some producers I've been to that do have oxygen on farm for their dystocias, but flow by oxygen is never bad for these guys. Other sedation other than the ket stun. Remember xylazine, it does have the possibility of causing pulmonary edema in sheep. I've personally only seen it once. There's no literature that I've found really on it, but it seems to be that I bet, I can't say, but I think that it is genetically linked with that sensitivity, because people I talk to, some people have seen it a whole lot and some people have never seen it. Some people have practiced 35, 40 years on sheep and use xylazine on a daily basis and have never seen it. But since there is that risk, I don't use it. The one time I did see it, it was a board-certified anesthesiologist that did give that xylazine to that ram and ended up dying on the surgical table. But it's rare, and I think it's population, so I do avoid it as best as I can in sheep. But there are alternatives that we can use. Your benzodiazepines, such as midazolam, work really good. Really enjoy it. Some, like I said, some drugs may not be available in your country, and we can talk about alternatives. But midazolam and an opioid should give you good sedation on a sheep. So, because I mentioned earlier, like some countries, such as Vietnam, ketamine's not available. And then several reversals that you can use for those animals as well. There's a lot of sedation protocols that you can use. What I suggest as young veterinarians is that you start using something that maybe you saw in vet school or one of your mentors likes. You get comfortable with that and then can branch out for different levels of sedation. If you just need a standing sedation, or if you need for them to lay down, or if you need to anesthetize them, basically the best sedation is what you're most comfortable with. I certainly have different sedation protocols that I'm really comfortable with that work real well, and other people have different sedation protocols than me that work really well as well. So it's really what's working best in your individual hands. High volume caudal epidurals, I really like these. So the paper that initially wrote this up, the dose was 1 mil per 2 to 3 kilos, and this was in cattle. And unfortunately, a lot of our literature comes from cattle, and not as much literature, unfortunately, is written up in small ruminants. So we do have to extrapolate. So there is a little bit of differences, but a lot of things we can extrapolate a bit, especially with things like a high volume epidural. So small ruminants, I do want to cut that back so that we're not getting up near the toxic dose if we need a little bit more lignocaine. And we're using these things for like a ventral midline C-section or an udder surgery that is not under a GA, or a significant udder surgery, or significant umbilical hernias. And you could bump this up probably to 5 mg per kg, the top end of the amount of lignocaine, cut down 1-to-1 with sterile saline or water. And that should go up all the way past the umbilicus. Okay, a bear block. It's a regional perfusion of lignocaine, and it was Dr. Augustus Baer, which was a German in the early 1900s, that initially invented the block. But really, what it is that it is just an IV regional block of a lower limb. But I just like to pay homage to the person that invented various procedures. And so you just put a tourniquet on, scrub it up. You find a vein, and you place a needle or a butterfly catheter and inject that lignocaine into that limb, and it works really quite well. If, say, you need to do a claw amputation or extensive surgery on a lower limb. Yep, this was the history lesson. So I enjoy a little bit of veterinary history, and sometimes other people do too, but this is just a little bit of history of how Augustus Baer developed this procedure and how it came back into favor. And it's certainly a procedure that we do, or human counterparts do a lot in humans, and it avoids a lot of general anesthetics. And in all reality, if we can avoid a GA, we avoid a lot of potential complications. So that's why, if at all possible, we will do nerve blocks and regional blocks for our procedures. Pain control. This is something I really enjoy. I say that it's very fancy medicine made very simple. So the quadrifusion is everything except midazolam. If the animal's not responding, you can go to the pentafusion, which adds midazolam. I've had a lot of really good success with just the top 4 here, and given as a CRI, I've really been able to control a lot of severe pain. I had a ewe-lamb that had monensin toxicity that just had a monstrous creatinine kinase, really high muscle damage, couldn't stand, really painful. We even put it into the underwater treadmill. Couldn't stand, but it wasn't painful. It was just sat there and ate. So that was the level of pain that I've been able to control in sheep with this pentafusion or quadrifusion. And that leads us into that particular case that we were able to control very significant pain. In sheep, it causes severe muscle necrosis, and this was the case that taught me how severe monensin toxicity is in sheep. In vet school, we seem to learn horses with monensin toxicity. If you look here, that seems pretty high. That's quite a bit higher. But when it is over several days, it doesn't take much monensin toxicity or monensin at all to cause toxicity. To go on to that case that I talked about just briefly, what happened with that case is that the sheep owner, it was a stud sheep, so valuable sheep, and he'd said, yeah, I'd lose one every year or 2 every year for the last few years, and didn't know why, and like, well, I'll finally decided to bring one into you, see if you can figure it out. And what ended up being is that the owner was buying feed from a local feed mill, and the feed mill had run a batch of cattle feed with monensin in it, but they didn't properly flush out the mill before running a batch of sheep feed. So there was just enough residue in that mill to cause enough monensin be in that feed to kill those sheep. I never heard the outcome. The owner said that the feed mill owner would make it right, and I was just happy to stay out of it all, and they never contacted me for further comment. But that was the case that taught me how severe monensin toxicity can be in sheep and how easy it can cause disease. So that was the sheep, 45 kilo ewe lamb. She was on a growing ration, and analyzed that grain, and that had 71 mgs of monensin. Lasalicid is another ionophore. From my literature reviews, it didn't seem to be as significant as toxic in sheep. But regardless, the monensin was enough over a long period of time, over a month, to cause monensin toxicity in that sheep alone. This is a monensin differential for red urine and muscle necrosis. Not an exhaustive list, but it is at least a partial list. And I'm sure different diseases around the world can cause similar signs to monensin. Copper toxicity, sheep are very, very sensitive to copper. It's not uncommon for people to go and buy the cheapest feed at the feed store, and that happens to be cattle feed because it's on sale. The cattle have a much higher need for copper than sheep, and they feed that cattle feed to sheep and develop copper toxicity. So they are very sensitive sheep. In some areas of the world, and it has become such an issue that they have limited or eliminated copper from the diet, and they develop a disease called swayback, where they can't stand, and they have obviously a swayback. And this is a lamb that we diagnosed with copper deficiency. They're born with this condition, and it's really not reversible. Okay. We'll get through blood transfusion, and then we'll take a little bit of a break. Blood transfusions are not something that you should be intimidated by. Ruminants, we're pretty lucky that we don't need a cross match. I do say that if you have to do one more than 14 days after your first one, then you probably should cross match, but that's a very rare scenario that you'll have to do it. And it's hard to decide when. If it's chronic, we're looking at probably an 8% seems like a good point, because placing an IV catheter cannula, you can cause a lot of stress, and the animal can die from that stress. So that the 8% is really my mark of when I'm going to do that transfusion. I might change that based on clinical evaluation, but that's my general rule of thumb. So usually the pre-made bags are easiest, the ones that are really probably made for humans, and they're just the easiest. Though you can make your own, and my last job we did make our own solutions, and this is the ACD solution, and that is how you do it, and then you dilute with whole blood. We're using the homemade ACD solution more for cattle that were needing, 10 to 20 liters of blood. How much? This is your equation here, and that's to be very precise. If you're in the field, and generic equation is going to get you pretty close. 1 mil per pound of body weight will increase the recipient by 1% of PCV, assuming that the donor PCV was of good quality. And I know my students, at least, they hate it when I say pounds, but there's 2.2 pounds in a kilogram. So you can do 2.2 mils per kilo will increase the PCV by 2.2%. Okay, I think we'll take a 10-minute break, and I'll come back at 5:30 my time, so that'll be 1 o'clock India time, and 10 minutes wherever you are in the rest of the world.
Yeah, you can take 10 minutes break, sir.
Parasitology. Question that our owners often want to know is they want to have the animal not to be parasitized at all. And that's, for the most part, it's unrealistic expectations. There are some places in the world that are heavily parasitized, and they keep maybe milking goats on a dry lot and avoid any potential of internal parasites that they feed off the ground, and they don't have any access to grass, but it's really not a realistic expectation for most of our producers. We want to keep the production losses at a minimum, and we want to make sure that we maximize our anthelmintics. And it's something that a lot of people just don't really appreciate, that we have to treat our anthelmintics like we do our antibiotics. Everybody appreciates antibiotic resistance, but anthelmintic resistance is pretty similar. That we want to have good use of our anthelmintics, and so that we can maximize their use. Certain groups are certainly more at risk, and those are ones that we certainly need to make sure we monitor. We do have subclinical infections, and those may be ones that we may need to treat, we may not need to treat, and we'll talk about some of those options. And then we have clinical infestations that they do need to be treated, and those are animals that will have a decreased production and or death loss. Haemonchus contortus is probably the most important internal parasite of sheep and goats around the world. It's known as barber's pole worm because when you do an necropsy on them, they can actually have a little kind of spiraling circle of blood in the worm in the abomasum. Now, teledysaugia, which used to be osteotagia, but it's changed names a few years ago, is also a very important parasite. It causes more weight loss rather than anemia, and Trichostrongylus will be the third most important. And then there's a few others that are of significance, but are of less importance in all reality. The Haemonchus is certainly the number one killer, and teledysaugia is her number two. Okay, fun facts. This is Australia. When I prepare reports or presentations, I always try to find fun facts, and that's what I like. I like fun facts. So there were actually 2 reported cases in humans of Trichostrongylus in Australia, and they used fresh goat manure on vegetables and clearly did not clean their vegetables appropriately. I found that interesting. So anthelmintics, there's no silver bullet, and there's no really generic plan that I can tell an owner without getting on their property, without talking to them. And we have to decide on what strategy we can use, and we'll talk about some of those strategies. I do recommend wormboss.com.au. It is an Australian website. So around the world, you may have to alter your perceptions a little bit, but it is very comprehensive. It's a very good website. I use it myself. When I talk about you have to decide on what strategies you can use, I work for a university, and the general public thinks you're the university, you can do whatever you want, you can make the perfect plan, and no, I really can't. I got put in charge of the sheep flock for a couple of years because we were having problems with Haemonchus. And, one of the things I want to do that I will talk about shortly is to cross graze with other species, and just wasn't practically possible to move the horses or the cows over to the sheep pasture. So I like to tell that story because there isn't any property, well, there probably are some properties, but it's not common that you can do every single strategy that you want for every property. You have to work with the owner and what is possible for that owner to make things better. So rotating anthelmintics, it is pretty controversial. And there's not as much literature out there as you really believe. And I don't believe in aggressive rotation. So it used to be dogma that you would rotate a different anthelmintic every time, that you would drench them, and that's not really the recommendation anymore. It's really trying to break the cycle. And when there are high populations of potential parasites, that's when you want to change it, or when there's weaning populations of parasites, when you probably have built up a fair amount of resistance. So through the summer periods for the wet areas, which is where we live in Australia, so wherever your wet area is, at the end of the wet area or wet time period is when you might want to use a new class to try to kill off some of those parasites that have built off resistance. Refugia is a term that many have probably heard of, but it is important, and it is the parasites that are left on the pasture, and it's the parasites that have not really been treated. So you have to think about it, that those parasites are not resistant, so that animal is going to pick up those parasites that are not resistant to your anthelmintic, and those parasites that are not resistant will compete with those parasites that are resistant, and it will lower the overall worm burden because the parasites are competing within the animal itself. It's a very important concept because we want to be able to maintain our anthelmintics that are able to kill off those internal parasites. And we want to try to minimize the treatments that we give because that will increase the number of resistant parasites. Same concept of antibiotics. The more antibiotics, the more resistant the microbes are likely to get. Same thing with the anthelmintics. So I don't recommend routine monthly treatments in most areas. Yes, there probably will be some areas that is acceptable, though we want to do our best to try to minimize those treatments. Some things that we want to not do is basically treat and move. So we treat the animal and then we move them to a new pasture the same day. We want to keep them on that same pasture so that they can excrete some of those bacteria or some of those parasites, so that they don't bring only resistant parasites to that new pasture, so that they're bringing some of those non-resistant parasites as well. So we have a few targeted selective treatments is what we call them, and we try and treat specific animals. So we're not treating everybody. We're trying to find those animals that don't need the anthelmintic, just like we're trying to find those animals that don't need those antibiotics. And it's good to keep them on that same pasture that they were on for 5 to 7 days before moving them on to another pasture, so that they can excrete some of those parasites that are, or so that they don't only bring over resistant parasites. Now, the sucking rate, it's interesting. I don't think I knew this until I prepared this talk. But what's interesting is that more than 2 small ruminants per acre, the parasite burden starts to accumulate. And that's not very many. For most production settings, some settings, yeah, you have massive million-acre properties. But for most people, that's not very many. So it does start to accumulate. And it does accumulate in certain areas where they like to congregate. They might have a favorite tree. If you've had sheep or goats, you know that they might have a favorite tree that they like to sit under at noon. This picture here is something that I've only seen it once. This was an alpaca farm, but I was really intrigued by it, and I like to put it in whenever I'm talking about parasites. But this was a little lawnmower that pulled a little trailer, and this was a vacuum. They went around and vacuumed up the feces of their alpacas to minimize fecal contamination in their pastures. I thought that was really, really neat. So that is one way. That's an it is an uncommon way, and as far as I know, it's the only one that I've seen. But it is one method, and these were very astute owners. But it is another way that I just like to show and demonstrate innovative ways that people are managing parasites. Okay, interspecies grazing is great. There is a few things that we do have to be aware of. Homunculus contortus, I don't recommend grazing calves under 6 months of age behind sheep because they can be fairly sensitive. Older cattle don't seem to be as sensitive. Camelids, alpacas, llamas, I've had countless cases where camelids have been grazed over sheep and they develop homunculus contortus and severely anemic or they're dying. And then a lot of the other things are really academic. Homunculus placei, which is in cattle, doesn't really seem to be a problem in sheep. It does show up in sheep feces. And Trichostrongylus axi can affect cattle and horses, so it is something if you're having a real problem with that parasite to be aware of. Hay management is an excellent way to minimize your parasite load for your small ruminants. The larvae do die in a reasonable amount of time, within a month of being baled into dry hay, that is. The one thing that you want to know is not coccidia. I have had cases where animals have developed coccidiosis from baled hay, from heavily contaminated hay areas. And really, coccidia does take a fair amount of contamination for this to occur in hay, but it is something to be aware of. Fomantia. Fomantia is a really great tool. It was developed by a South African veterinarian, and it uses a scale of 1 to 5 to how pale the mucous membranes of the conjunctiva are of the small ruminant and sheep. I believe it was originally used for goats, but it's been widely accepted for sheep as well. And it aids in decreasing the amount of anthelmintics that you have to use. And you can also use it to select sheep, and we did that at the university here at Queensland. I developed a little spreadsheet that showed how many times the animal was treated in the past 8 months, 10 months, and culled all the ones that needed a lot of anthelmintic, and we have certainly improved our resistance or our efficacy of our anthelmintics and our animals' resistance to the parasites. And this, I didn't write it up, but another group wrote it up, and I'm showing a similar process. So not me, but somebody else. It is in the literature now. A couple of years ago, I believe I read it. The cons, it's only effective at diagnosing homunculus, so you do have to make sure that you are looking at other issues. If the animal is thinner than the rest of the group, or if the animal has diarrhea, I'm usually thinking that they have a trichostrongylus, and I will be treating those as well. And it does require more frequent handling, so it's not really good for the really large mobs, but the smaller groups of animals it can be quite effective. There are certainly interesting options. Copper oxide wire particles, I've never used them in sheep because of the copper toxicity in sheep. Used them in goats, and one of my colleagues used them in a herd of alpacas, all with favorable results. So that it is a really good option for goats, but I would be very careful using it in sheep. And there are some breeds that are more sensitive to it. High protein diets, if you can increase their protein by giving them protein supplements, this certainly does help. This is something that we've also done at UQ, and I've recommended and implemented in many herds and flocks. And there is literature to show why that it does help. And it really does can work a lot. So it may be increasing their general nutrition, their general health, but the protein seems to be the critical point of helping out these animals fight off the parasites. There is a vaccine now. It's Barbavax. I'm not sure everywhere that it's available in the world. It is labeled for lambs and ewes. I know people that use it for goats. The cons is that I have talked to the company representatives of it, and their goal was to get in on the large sheep flocks of Australia. So it does come in 250 dose vials, which is quite a lot. So I have known some groups of people that they get in and buy vials together and inject all their flocks or their herds, and it does require multiple injections. There are some nematode trapping fungi. I understand that there are some commercially available around the world, and they do. The literature does seem to support their efficacy, and it is another tool in your toolkit to fight the parasites. Tannins is something that it is used. I can't think of a producer that I've particularly had this implemented, but they can plant certain plants in their pastures. The problem with high tannins is that they aren't that palatable, so they may not eat them as well when they get into really high tannins, but they do help to support the animal with the parasite problems. These are some common tannins that have been used or in literature and research that seem to help, but it does take a fair amount of tannins to actually be effective. So like chicory might be something that people plant here in Australia, but tannins really aren't high enough to show that there's probably enough tannins in the plants to help out the parasites. Okay, urolithiasis. This is one of the ugliest diseases that I think we deal with small ruminants because it's so difficult to manage once they have it. An ounce of prevention is worth a pound of cure on this one. I've sat in many lectures and I've listened. Whenever there's a conference, I go to the urolithiasis to see who has the new best idea. I feel very well versed in it, but it's still one of those diseases when I hear block goat, I cringe. So we'll talk a little bit about several aspects of this disease. The two most common places will be the distal sigmoid flexure and the variform appendage. So that's the bit at the end of the penis that is kind of like a worm. So that's variform appendage. So if you work on cats and you do block cats, you're like, oh, why don't you just put a catheter in there? The problem is that we have this diverticulum, or urethroddiverticulum. So you can see the urethra is quite small, and it's right when you're going around there that that catheter is likely gonna go into that diverticulum. There is some work trying to get some new catheters that bend a bit differently, that'll bend down and hopefully bypass that urethroddiverticulum. But I really haven't seen them catch on, or the literature just yet that really supports them. But that's one of the ideas that's out there. So when I talk about small ruminants, one of my top differentials, if the animal is acting abnormally and is male, urolithiasis is on the differential list until proven otherwise. It's highly variable. Some people say that the animal is constipated. Small ruminants don't get constipated very often. Very, very rarely. It's a rare thing. One of my American sayings that my Australian students are catching on to is ADR. It's ain't doing right. Really anything that the animal is going through. My fun with words, grinding teeth. That's the $1 word. Bruxism is your $3 word. Odontoparesis is your $5 word. All means the same thing. I just like fun with words. One thing I do on my clinical exam of a male small ruminant is I will palpate that sigmoid flexure, so underneath the anus, as the penis is going down between the legs. If there's pulsation, very common that it's obstructed, and I'll also feel the prepuce for any crystals. If there's crystals there, then there's a good chance that you want to be looking at urolithiasis. Okay, animals that are pets are often castrated young, which I am a full proponent of castrating animals as young as possible for pain, animal welfare. Though for small ruminants, at least, that are going to be pets, I do suggest castrating them later in age, and I do that. I've done that many, many times, but I do that very humanely. I fully sedate them so they are in lateral recumbency, lignocaine intertestically, and in the cord, and a line block through the skin, and anti-inflammatories. And they get up and they do very well in owners report that they don't look back. So as long as it's done well, I think that you can castrate them at an older age, and that allows you to have a wider urethra, so hopefully the stones can pass more easily. If they have water belly, which is that the urethra or the bladder has ruptured, it's not game over. I've certainly saved plenty of them, but that is an obvious sign, and that's when there is fluid usually in the subcutaneous space from the urethra. So this is the literature of lambs and kids. There's only one paper on this, and it's been widely debated on some of the listservs that I'm on. But even with kids, I still recommend them being castrated 3 months of age or older. Blood work, it is helpful on these cases, but not absolutely required if it's a cost issue case. With these, you can suspect hyperkalemia. That is, in the literature, that is the most negative prognostic indicator for these cases, so you want to avoid giving potassium. And we'll usually just start with isotonic saline. Radiographs, it all depends on the case and the commitment of the owner. They're great if you can have them, but not absolutely required. It all really depends on your conversation with the owner. How committed are they financially to this animal? And that's obviously can be a difficult conversation. And it's a conversation that we'll have with all animals. It doesn't matter if it's a dog, a cat, a horse, or cow, or a sheep. We're going to have those conversations because there's going to be some people that can't afford everything that you want to offer. There's a lot of options, and that's what I was just saying, is it a low cost or is it everything you can do option? Is it very, yeah, that's really what it is. That's a conversation you have to with the owner and have to be honest with them about outcomes, and we'll talk a bit about the outcomes. Sedation, Torb and ACE is what I reach for first. We try to avoid xylazine, of course, because that causes increased urine production, and we don't really want that if they're obstructed, if their urinary system is obstructed. And of course, in sheep, I try to avoid it as well. Lots of alternatives, your benzodiazepams, ketamine, Torb. Usually reaching for my benzos or my ACE, as they do cause some smooth muscle relaxation, and it can allow that the stones to pass a little bit more easily. First thing is amputate the variform appendage or urethral process. I find it easiest if I can sit them on the rump and then extend the penis and cut off the appendage. And if you haven't seen a variform appendage, it kind of comes off at an angle. So you can't cut it straight. You have to cut it at the angle where it attaches to the penis so that you take all of it off and not just part of it. Success is 10%. It can be done. I did it twice as a resident. But it basically takes you're sitting there most of the day. Whenever you're not seeing another patient, you're sitting there with that sheep or that goat and managing that goat very intensely. But that, so that was medical management. But I do warn you that the success is quite low, and that's literature is 10%. Yeah, so I did manage those two medically with ACE, diazepam, and extending that penis and getting those stones removed. So it is possible, but it is unrewarding. And just to let you know that, yeah, it's not, it can happen. This point here, one of my past students, without calling me first and then calling me later, gave a 0.5 mg per kg to a steer, and it cured it. I know that's not a small ruminant, but I'm not sure if I'd really recommend that. My anesthesiologist would have a heart attack if they heard that. I was pretty nervous about that as well, but the steer apparently did well. I don't really recommend that, but just to tell you fun things that I've heard. Ammonium chloride, you want to start them off on ammonium chloride to acidify the urine. It doesn't taste real well, so it is a syringe-fed thing and diluted in a little bit of water. You want to start off at 100 mg per kg, orally Q12. The literature goes up to like 350, 400 mg per kg. Unusual one. We had one at our clinic the other week that did require quite significantly more ammonium chloride to get the urine pH down. Fresh water, access to free choice salt, and then the e-collars or the cone of shame. Goats really like to chew on stuff, so if they have had a surgery or what we'll talk about soon, a tube cystotomy, they'll want to go and try to chew anything out. So goats do pretty well with the cone of shame, playing grass hay, and really walking. Mental stimulation, I think, is great for these guys. Just getting them out there, browsing, eating some leaves. And we all know goats just love to eat leaves. They're browsers. You can do assisted synthesis. It's usually temporary. I prefer ultrasound guided. You do have a risk of excessive urine leaking. One of my mentors warned me about it. I've done it several times. I haven't had significant problems, but it can be a problem if the bladder is significantly distended. And really, the big thing is it's allowing for patient stabilization. So if you have something coming at midnight, you can stabilize it, get the blood work okay, get the potassium down, and you can anesthetize it the next morning. Whirlpool solution is an option. This was the initial study, and it looked like it was going to be amazing, and it was going to be the best thing. More studies have shown that it's not as great as we initially thought, and it's a acidifying solution. Basically, you put a needle into the bladder, pull out the urine, inject the Whirlpool solution until you get the pH down. But it is an option, but it's not the silver bullet that we thought it might be. Diluted vinegar is the inexpensive option, which you can certainly do as well. Same methods. Citric acid. Ruminantine is the brand name of that. Okay, so we have surgical options. There's a lot of options, and when I say there's a lot of options for a potential disease, that means nothing is ideal, because nothing is perfect. So I'll try to walk you through what the options are and how to decide when to choose what option. Okay. So probably the common procedure is perinatal urethrostomy. This, if the animal is still intact, has his testicle still, eliminates his breeding potential. It's fast, it's inexpensive, and at least in the USA, it can still show. And as far as I know, in like to a livestock show. So this was a young kid's lamb that came in after hours, and they sent me pictures of the lamb at the show, and the lamb actually ended up doing pretty well in the show. So this is it. You can see the legs. That's the anus up here. Usually we start with a low PU. One of the potential problems is that you can have a lot of bleeding because you have ureokinases. They're naturally in the urine to prevent blood clots forming in the bladder, which is a good thing for the most part. Sometimes you can have constant dripping for days, and you have to deal with that and may have to cauterize that, obviously, with pain relief and epidural if that continues to bleed. Has a high stricture rate. Most of the time 8 months of age. I can remember probably it might have been the first one I did as a first-year graduate. Goat's name was Cookie. Cookie was a miniature goat, and we did a tube cystotomy that we'll talk about sooner, but somehow he still ruptured his urethra, so the option was a PU, perinatal urethrostomy. Came in after hours, and I got the student, put the goat on a scale. I looked at it really quickly and then I went into the other room, started gathering things. We had a built-in scale into the floor. Goat was walking fine, and then the student screams. Cookie fell over, and I run out, ready to resuscitate the goat, and poor Cookie died. So that's the thing that that's a lesson that I've learned, that no diagnostic test, even getting a weight, is benign. So a goat died when we were attempting to get a body weight on it on a scale that was built into the floor. So yeah, I'll tell my failures. So typical approach, we like to go low first. High is near the anus. So we reserve the high if the low blocks. And not always. Sometimes these goats and sheep can go on for years and years with a PU. But most of the time they do block at 8 months. This was one study that showed a high PU. It's the only study that I've seen. And it worked really well. But this is a procedure. They have really strong ligaments between the tuberacii and the penis. So I have practiced this on cadavers, and that's certainly what I would suggest before you try it. And a lot of owners are perfectly willing to allow you to practice procedures on their animals so that they can be of better use. Some owners obviously won't. They're beloved pets. They're very valuable animals that are going to be buried on the property. Tube cystotomy procedure tends to be the most successful. This is the best paper. There's been a lot of papers on it, up to 86%. I usually tell owners 75%. So 3 out of 4 are going to live, 1 out of 4 is going to die, assuming that the potassium is within normal limits. It is more cost. They do need general anesthetics, and they're going to need a fair amount of aftercare. Pygmy goats always seem to be overrepresented. These are retrospective studies that always do this. So is it legit, or is it just pygmy goats are more often be pets than, say, boar goats? You know, it's a retrospective study, or they are all retrospective studies. So it's hard to say, but these are the fun facts of the one paper that represents most of the papers. So general anesthesia, draping, full procedure, pull up the bladder, put in some purse strings in the bladder to hold it in place, and then make a cystotomy. Put that Foley catheter into the bladder, blow up the balloon and Foley catheter, and then bring it out through a separate hole, and then let it drain out. And then this is just the finger off of a latex glove with a little slit in it, so it works as a one-way valve that the urine can drain out and things can't come back up. And that's the incision line, and we just reflect that prepubescent penis to the side and make a linea alba incision. And just want to make sure that you don't enter into the penile tissue or the urethral tissue, of course. Once you're done, you want to acidify the urine, put the cone of shame on the one, and then we put the mask on the other. That's the friend. They always do better with a friend. And then we can take the mask off and let them eat throughout the day. And then we'll clamp that tube, and basically the animal will need to be able to urinate for a full 24 hours before we pull that tube. You can use a permanent tube and then replace it every couple months if they are refractory towards that clamping and being able to void their urine. Bladder marsupialization. This is essentially doing a laparotomy eventually and getting the bladder and suturing the bladder to the skin so that it's constant dripping of the urine. The biggest question I get asked is, oh, aren't they going to get bladder infections? And really, no. From my experience in the literature, they don't really seem to get bladder infections, but what you need to make sure is that you don't make it too big. I'll probably make it 2 to 3 centimeters diameter for the incision, there for the marsupialization, and then it kind of shrinks down to 1.5 to 2. It is unacceptable for some pets that are house pets. And in the U.S., people would have house goats and house sheep. I got to Australia, and people told me at conferences that's not a thing. But at least in Australia, I have met house sheep and house goats. So it is a thing here, and I'm sure it's a thing in other countries. So they will need some antibiotics, penicillin. Your beta-lactams will be a good choice because it is excreted through the urine, anti-inflammatories, of course, and then fluid relief to help to dilute and flush those kidneys. And if they are hyperkalemic, to manage that hyperkalemia as well. And you want to be really realistic with the owners. I tell them right up front, if they want to do everything they can, there's a 25% chance of death. And here at the uni, that's, I'm in hours, I'm quoting 3 to 4 grand Australian dollars, after hours 4 to 6, 7 after hours. So I mean, it's a risk, but it's the owner's decision if they want to do everything they can. These are real common uroliths, and they tend to be in different areas. It all depends on the soil and the grasses as to what the animals might get. If there's more calcium in the soil, or if there's more phosphate. We'll talk about it in a minute, but we want to avoid grain and lucerne or alfalfa. It's the same thing depending on where you are in the world. And try to manage their diet as best as we can. So calcium carbonate, so they're little copper spherical BBs. And they are unfortunately not responsive to acidification. Certain areas will have silica or oxalate stones. And then to get very specific, the owners are very committed, can formulate very specific diets, and these are the areas that are recommended to manage of the diet. I really say that grass hay is best. And if the animal wants snacks, carrots are usually the best thing that I recommend, but there are other options. It's just because you can usually buy a big bag of juicing carrots fairly cheaply. So in summary, there's a lot of options. The owners really need to commit if they are going for tube cystotomy or bladder marsupialization. And they are likely to recur, and the owner needs to commit to a good diet for that animal. Okay, caseous lymphadenitis or cheesy gland. It is a common bacteria that we deal with in small ruminants. In cattle, it's known as ulcerative lymphadenitis in horses and cattle. So we'll talk about some of the differences, and I've certainly seen it much more in sheep and goats. It's really gained from wounds and cuts, so it's oftentimes with shearing of sheep. So the black blades of the shears might nick the sheep and get contaminated and then contaminate the next sheep. Sheep may be different, that they only get internal lymph nodes affected, so that can result in another cause of chronic weight loss or respiratory signs in the sheep, whereas goats, they usually at least get systemic lymph nodes, so external lymph nodes that you can palpate that are enlarged. The incidence can be quite high, and it can be difficult to remove from the property. There are some options that I'll talk about. Typically, if you have a lymph node that's enlarged and you do a fine needle aspirate and you get a green tinged cheesy appearance, it's pretty diagnostic. Whenever I've seen it a lot, it always comes back as cheesy gland. So some owners, they don't want to pay for the culture. So I'm pretty confident that's what it is. Really, it's trying to remove the animals and keep those infected animals away from all the other animals in the flock or herd. Treatment, there's a couple of options. You can lance and flush, but then you are going to contaminate the environment. There was a good paper a bit ago that showed that injecting trilithromycin or Draxin, aspirating what you can from the lymph node and then injecting Draxin into the lymph node was a pretty good cure, and you didn't contaminate the environment, but you still want to keep them separate from the uninfected animals. Okay, so vasectomy is something that we'll do on rams to create teaser rams or to bring ewes into season altogether. It's a really pretty easy procedure. Just go right over the cord, incision, pull the incision out or pull the cord out, isolate the vas deferens, and you'll sew those off. So it's a really pretty easy, pretty quick procedure that you can do for some of your producers. It's done on larger properties usually, but some smaller producers may request it. So this is a nice, easy practice tip if you're in a small practice away from a lab. You can do your own fibrinogen. You don't need a lot of equipment. You just need a microcentrifuge. You spin 2 hematocrit tubes down, record the solids, and they only heat up. Heat them up for 3 minutes, and then you respin, and the difference between the 2 solids is the fibrinogen concentration. So you can just get some hot water in a thermos. You just need some capillary tubes and some clay and a reader, and you can tell the difference between the two. It's a really quick and easy way, inexpensive way you can test fibrinogen in the field, which is an acute phase protein, which is highly related with inflammation. Okay. I think we'll just keep on going. We don't have too much left. So Johne's disease, it has different incidences around the world, different countries. I saw a whole lot in the U.S. I haven't seen very much here, but I have diagnosed it here in Australia. But there are differences in small ruminants than there are in cattle. We usually all think of cattle when we think of Johne's. So camelids are susceptible as well. Cervids, deer, elk, and bison are too. So it is, most of our ruminants are susceptible to it. This is our history. So it was diagnosed a long time ago, and it is a very difficult disease to control, and it has a fair amount of controversy. And it has come to Australia in the early 1900s. So some of the differences, cattle, we always think about that cow that has a ferocious appetite, losing weight, and has pipe stream diarrhea, but not really the case in smaller ruminants. Usually they aren't eating well, they don't have diarrhea, and it's just weight loss. So it can be a little bit more difficult to diagnose. So we can't just think pipe stream diarrhea. This was a Johne's cow, classic Johne's cow, pipe stream diarrhea, super skinny, and she did have a voracious appetite, a very good appetite. So this was a study that looked at goats with Johne's. The majority of them were inappetent. Majority of them had normal fecal pellets. So it really doesn't fit with what we classically think of Johne's in cattle. So we do have to think a little bit differently. So they're losing weight. So that is the same. That is Johne's cow. That's a normal cow. So there's a lot of other things that we do need to think about when we're thinking about weight loss. We've talked about a few of these today, but these are some of the big things that I have on my list when I'm thinking about a skinny sheep. So we do have some real-time PCRs and cultures that seem to work fairly well. And serology, similar in cattle, helps with surveillance. And interesting, we'll talk about antemortem ultrasound. So this was the same study, scanning the animal's lymph nodes, and it was a portable machine, so that's something that you could have in the field. So almost all of them had enlarged mesenteric lymph nodes. So if you do scan them and they do have enlarged internal lymph nodes, it is something that you want to consider. There are certainly other diseases like cheesy gland that you want to consider as well. Necropsy is always the gold standard. They will likely be emaciated. A lot of animals with emaciation, they will have some kind of clear adipose tissue around the heart. That's a good sign that they've had, they haven't been eating, they have been basically starving. Want to collect lymph nodes, and still the ileocecal junction is still important. But they just may not have that corrugated ileum that we see in cattle. So this slide does show that an emaciated carcass is a good example of, or a good reason that the animal may have Johne's, but yet again, like I said in previous slides, that it could be a lot of other things. And only, still the majority, but half of them had thickened intestinal walls, where the majority of cattle will have that. And the corrugated ileum wall, which most cattle will have, our goats tend to not have that classic corrugated ileum. So this is a disease to suspect with weight loss. It is one of many, but it is something that should be on the list and workup, especially if there's history of Johne's on the property. But you may be the first one to diagnose Johne's on that particular property. So it is good to have it on your list. And you can confirm with PCR or culture. Both are really quite good. Culture is still the gold standard, but PCR has shown really high accuracy. So diagnosing it, your basic clinical exam, consistent with those Johne's findings. If the animal is suffering or the welfare is in question, then a necropsy is indicated. and that is certainly the gold standard of diagnosing this disease, and histology can aid in the confirmation. So this is a cow with a classic corrugated ileum that most of you probably have seen a similar picture of. Thus I put this in here to make the point that this is not really common in our small ruminants. Enlarged lymph nodes is certainly common, and we'll take these and submit them for histopath to help to confirm the diagnosis. So acid-fast staining is the diagnosis of choice, and you can see these bright pink areas. That is the yonis taking up the stain. So there are other mycobacteriums that will stain that aren't really pathologic. So it is not a fully confirmatory disease or test, but it does aid in your diagnosis. Transmission still the same, fecal oral colostrum. They typically acquire it when they're young lambs or kids, and when they're confined and that fecal load on the pasture is higher. It's very tough to manage, just as in cattle, and the bacteria remains viable for quite a long time in the environment. Thus, it makes it really quite hard to manage. And there is no treatment, and it is fatal. Supportive care may get the animal along for a little while if the animal needs, the owner wants to, say, flush some embryos, but usually it's quite unrewarding. So we do have two strains. The goats do not have their own strain. The cow strain tends to affect the goats more than the sheep strain. Interesting thing with the sheep, when cattle are removed, the cattle strain doesn't seem to maintain itself in the sheep if they are co-grazing in the same area. And the sheep strain is less common in goats and less pathologic than the cattle strain. And cattle don't seem to be affected by the sheep strain, so it only goes one way, cattle to the sheep. But so there has been some work to show the sensitivity to develop the disease, and the goats are unfortunately the most likely to develop the disease. I've certainly seen much more in cattle, but that's just because of probably the herds that I've worked with. So this is just basic pathophysiology, how the bacteria enter, and how the bacteria persists, that the macrophages can't actually destroy the bacteria, and then eventually it causes the malabsorption of the intestines. Vaccination is possible. It'll vary from country to country, but it's typically only available through government veterinarians because it does interfere with testing of other diseases such as tuberculosis. So it does have to be regulated through most government officials. There is some potential for genetic selection. It is another tool in our tool bag, but it's not something that I've had many people really go after and use. In the U.S., it's usually a disease that just accept and try to manage. In Australia, it's not as common, and people will usually just try to manage it, and it'll vary from country to country. Surveillance. Since it's such a slow-growing bacteria, it's not really reliable until the animal is older. So it's really hard to get a positive under 18 months of age. And PCR in a smaller ruminant seems to be the best. So that's what I'll usually recommend. ELISA, not as reliable in cattle as it is in sheep, but it is a good surveillance tool to help figure out where or how many or how prevalent the disease is in the herd or the flock. This is just a list of testing to help out whatever purpose the animal want or the owners want. They're just trying to control or eradicate. These are just suggested protocols for those different groups of animals. Prevention, it's really, really difficult. Close herd and really test all incoming animals. And it is one of the diseases that I do recommend people test for when they're bringing in animals to try to keep it out. And really, we want to keep the areas where the animals are lambing or kidding as clean as possible, and separate the positive and the negative animals as best as possible. Zoonosis, this is a controversial issue. Crohn's disease is the disease in humans that has been associated with Johne's disease. It's up for debate. So I'm not here to say what is true. There's a lot of very intelligent people on both sides of this issue, and I've listened to them both. What it is humans do have, with Crohn's, do have a higher chance of having Mycobacterium avium. But we don't know if that's necessarily causing the disease or if it's just an association because they have a lower immune system. It's managed as an animal health disease in the US and Australia, and some countries do manage it as a public health disease for humans. There was a paper a while ago. I haven't looked at the recent update on it, but in the US, there was a survey of human gastroenterologists that thought that Crohn's was a genetically mediated autoimmune disease. I'm not saying that it is, but that was an opinion of some experts. And like I said, countries will manage it differently as an animal versus a public health disease. So clinical signs are very different. It's very long incubation, just like cattle. Difficult to diagnose, potential zoonosis. There's lots of information available, but there's still lots we don't know. Okay. So that is it for me. Are there questions, comments? Any other diseases in other countries that I didn't cover that are significant? I guess I didn't cover a lot of foreign animal diseases here in Australia. But
Thank you, Dr. Aaron FRASER. Indeed, a good lecture going up 2 hours 10 minutes. We enjoyed your lecture.
Thank you very much.
It was informative, and more information were covered on Pharmacia score use of lidocaine, and indeed that bear blog was a new one, and elaborate discussion was on urolithiasis and blood transfusion. So there were a lot of questions. I'll put across in a send you to our mail, and the important questions alone, I picked up 4 questions for you. Please tell what is that J-lube? Can you tell what is the composition in dystocia? J-lube is new.
Yeah, I can't tell you the exact. I'd have to Google it myself.
Okay, okay.
But it comes in a powder form, and it's a reconstituted powder, and you mix it with water. It comes in like a little, kind of a white bottle.
Yeah, that bottle, we saw it in the picture. I think that is the bottle you're mentioning. We saw that small bottle, yeah.
It is, yeah.
We have here lignocaine gel that we use. So because this J-lube was new, so that's why the question was. Then the next is GV26. We do it commonly in case of dogs. For the first time, I am hearing it in small ruminants. In fact, that is a very good acupuncture point for dogs, and we really appreciated that point in small animals. So, will you please share your experience in small ruminants?
Yeah, I really like it. I was lucky enough to take an acupuncture course, and that's a whole nother lecture, I suppose. But yeah, I really like GV26. It's uninvasive, and I know people use it in puppies and as well. And it seems to work pretty well. And I've never really had complications, and it's something that's easy that we can train our producers to do if you can't get out there when they're doing their own dystocias or their own lambings and kittings.
So do you recommend 20 to 22 gauge or still 23 or 25 needle for Gen Chunk point?
Yeah, I think I said 22, 20. I think I'm usually picking up a 22 gauge.
Okay. Then regarding the blood transfusion, what is the cutoff for pack cell volume? In the lecture, you have put 8%, seems good.
Yeah, so that's the point when the animal is anemic. When I'm for chronic anemia for like parasites for Haemonchus, not acute anemia, like if they had a bad laceration, but for chronic, 8 is usually the point where I'm considering a blood transfusion on that, and it's 20 to 40 mils per kg. I didn't put that in the lecture, but that's usually what I do. And if I can't, yeah, and that usually works pretty well. I haven't had any problems with any viscosity issues of the blood on the animals going up to the 40 mils of whole blood on per kg in ruminants.
Now, we usually follow the 15% thumb rule, and then if there is a decreasing trend of PCV, maybe 12, we have that as a cutoff point based on constable et al. So because this 8% you have told, that is a new thing for a small ruminant. That's why we have just asking your experience on that.
Yeah, it's certainly debatable, and I'm very well of Constable's work. Very, very excellent researcher and contributor. I developed the 8% talking to a lot of other veterinarians. As long as it's chronic, if it's acute and they get below the 15%, then yeah, definitely. But I've had some problems between that 8 to 12% where they do struggle a bit, and it is a bit of an art, I guess, with the chronic anemias caused by things like Haemonchus.
Okay. Then only the last question. You were telling about Walpole's solution during the discussion on urolithiasis, something to do with citric acid and vinegar.
Yep.
before that, you told the Walpole's solution. What is that composition?
It's a commercially available acidic solution, at least in Australia and the U.S.
Okay. Okay.
I can't remember exactly what the acidifier is, but it is, yeah, it's a commercially available acidifying solution.
Okay, we got it, because I think that must be a commercial preparation. So just we wanted to know the composition. Otherwise, I think citric acid and vinegar will do the best.
Yep. Yeah. Vinegar is the easy, inexpensive method.
Yeah. Thank you so much on behalf of organizing committee and TANUVAS, Tamil Nadu Veterinary Animal Sciences University. We wholeheartedly thank you for immediately accepting to present on this topic, and our students and practitioners have got very benefited, and they got important as tips for their practice. Now may I call upon Dr. Napoleon, who is the organizer and Professor and Head of Department of Clinics, to say a few words. Dr. Napoleon, please. Dr. Napoleon.
Vijay, is my voice audible?
It is audible, sir. You can just
Okay.
switch off the video and then please talk, sir.
Switch off.
Switch on.
Yeah. Now the camera is on. Okay.
Just a few words and then.
Yeah. So on behalf of the Tamil Nadu Veterinary and Animal Sciences University, I would like to extend my wholehearted thanks to Dr. Brandon Fraser, who has given an extensive talk on the small ruminants. And Dr. Fraser, you are very much aware that goats, they are called as the poor man's cow of our country. And then you have described wonderful things, certain new things which have been lucrative and attractive was this Bayer block. Okay. Next, the relieving pain methods you have explained, that is pentafusion. Everything was very nice. Then the copper wire particles, copper oxide wire particles. This is really very nice. And I have just heard, but again, this is a new term, that is the fungi that is destroying the nematodes. Okay. Next, your care and approach for erythrostomy with catheterization and mass spraying for controlling the parasites, that machine, everything was fantastic. So on behalf of the Directorate of the Clinics and the organizing committee, once again, I would like to extend the wholehearted thanks because this has been benefited all the practitioners, undergraduates, postgraduates, everybody. So once again, thank you. Have a nice day.
Thank you very much. It's really an honor to come along, and if I can ever help out again, please let me know.
Yeah, thank you, Brian Fraser. Thank you so much.